Hello, I'm Yassir Javaid, a GP with a specialist interest in cardiology based in Berkshire in the United Kingdom. And in this recording, we're going to focus on how to empower patients with home ECG and blood pressure monitoring. Well, the appetite for adopting innovative technology and solutions in healthcare to make every contact count more, I think, has never been higher. And I think solutions that can be deployed without having to increase patient flow into clinics and hospitals and enable opportunistic or remote detection of risk factors like hypertension and atrial fibrillation can hugely streamline diagnostic pathways. They can improve efficiency, reduce the time to diagnosis, and crucially, enhance that patient empowerment and ultimately should improve patient outcomes. And patients who feel more in control of their health and risk factors tend to be significantly more engaged as well as compliant of their prescribed management strategy. So hypertension and atrial fibrillation are potent and common cardiovascular risk factors that often develop in patients who are blissfully unaware of them. And sadly, many patients are undiagnosed and therefore untreated at the time of their often devastating cardiovascular event. I refer to these two risk factors actually as the silent killers in cardiology. Hypertension being associated with an increased risk of both atherosclerotic cardiovascular events, such as heart attacks and strokes, as well as heart failure. But timely diagnosis and management of hypertension can hugely mitigate this excess risk. And the most accurate way to diagnose and monitor hypertension has to be remote patient self-monitoring and using an average of lots of home readings. And then we have atrial fibrillation, the most common sustained cardiac arrhythmia, with a prevalence increasing sharply with increasing age, a lifetime prevalence in the region of 1 in 3. And once patients develop their AF, that stroke risk has already increased by over 500%. And there is a real need for urgent diagnosis and anticoagulation of these patients to prevent catastrophic AF strokes associated with really high morbidity, mortality, and disability. And again, just like with hypertension, timely diagnosis, appropriate anticoagulation can hugely reduce that risk of stroke. So the two risk factors are intrinsically interlinked. Hypertension being a big driver for developing AF, as well as increasing the risk of stroke in patients with AF. So it makes perfect clinical sense to have this technological solution that can screen for both of these risk factors. Patient education is the key really to successful usage of these devices. A device is only as good as if it's used appropriately. Firstly, patients, I think, need to be aware of the critical importance of identifying these risk factors. High blood pressure in terms of overall cardiovascular risk, and also the importance of identifying atrial fibrillation as a potent independent risk factor. Because as I said, both of these conditions can be present without patients even being aware of it. So they may not even know they're at increased risk. And then, of course, patients need to be aware of the technicalities of how to use the device. For instance, in terms of blood pressure measurements, what position they need to be in, how many readings they should be taking, and how often. Clearly, we don't want patients preoccupied by taking too many readings every day of their lives. But at the same time, we need to reinforce how important it is to take multiple readings over a time period. For instance, I normally advise twice a day for a week, every few months, to get that accurate reflection day-to-day blood pressure control. And I think patients also need to be aware of the importance of a speedy medical review if they're found to have atrial fibrillation or it's suspected to have atrial fibrillation, to ensure that they get timely confirmation of the diagnosis and, much more importantly, timely deployment of that critical stroke prevention strategy. I firmly believe that to have a technological solution that can both accurately monitor a patient's blood pressure and at the same sitting being able to check the heart's rhythm with an ECG rhythm strip to look for atrial fibrillation is a truly major breakthrough in terms of deploying an optimal and efficient cardiovascular prevention strategy, as it can hugely facilitate the earlier detection of two potentially devastating cardiovascular risk factors and therefore hugely improve patient outcomes. Potentially, for our patients, adding both a significant number of years to life, as well as a significant amount of life, to those years.